I am Dr.K. Anbarasi, Associate Professor, Department of Chemistry, Nirmala College for Women, Coimbatore. In this video, I will discuss about antineoplastic drugs in medicinal chemistry. The video includes introduction, classification, function, and uses of antineoplastic drugs, causes, symptoms, and risk factors of cancer, types of cancer, treatment, and prevention of cancer. Antineoplastic drugs are medications used to treat cancer. These drugs are also called anti-cancer, chemotherapy, chemo, cytotoxic, or hazardous drugs. These drugs come in many forms. Some are liquids that are injected into the patients, and some are pills that patients take. The classification of antineoplastic drugs includes alkylating agents, antimetabolites, natural products, hormones and antagonists, and miscellaneous. They are type of drugs that inhibit the enzyme production necessary for DNA and RNA synthesis. This means they affect DNA synthesis and therefore interfere with cell division and tumor growth. Uses of antineoplastic drugs. They target cancerous cells by attacking the life cycle of a cell. Cells go through different phases as they grow and multiply. Cancer cells tend to grow quickly. It means they go through these phases quicker. By targeting these phases, healthcare professionals hope to kill these fast-growing cancer cells. Functions of antineoplastic drugs, mainly in cancer treatment. They can be used in cancer treatment as they interfere with the DNA protection and therefore cell division and tumor growth, because cancer cells spend more time dividing than other cells, which inhibiting cell division harms tumor cells more than other cells. Antimetabolic drugs are commonly used to treat leukemia, cancers of the breast, ovary, and the gastrointestinal tract, as well as the other types of cancers. It is a large group of disease that occur when abnormal cells divide rapidly and can spread to other tissue organs. Cancer rapidly growing cells may cause tumors. They may also disrupt the body's regular functions. Cancer is one of the leading causes of death in the world. Causes of cancer. The main cause of cancer is mutations or changes to the DNA in our cells. Genetic mutations can be inherited. They can also occur after birth as a result of environmental forces. These external causes called carcinogens, which include physical carcinogens like radiation and ultraviolet light, chemical carcinogens like cigarette smoke, asbestos, alcohol, air pollution, and contaminated food and drinking water, then biological carcinogens like viruses, bacteria, and parasites. Risk factors of cancers, which includes tobacco use, high alcohol consumption, an unhealthy diet characterized by red and processed meat, sugary drinks and salty snacks, starchy foods and refined carbohydrates including sugars and processed grains, a lack of physical activity, then exposure to air pollution, exposure to radiation, and unprotected exposure to UV light such as sunlight. Then symptoms of cancer, they are lumps or growths on the body, unexplained weight loss, fever, tiredness and fatigue, pain, night sweats, changes in digestion, changes in skin, cough. Then treatment, according to the type of cancer, there are three kinds of treatments are possible, that is localized treatment, systemic treatment, and palliative treatment. In localized treatment like surgery or local radiation therapy at a specific area of the body or tumor, systemic treatment which contains chemotherapy, targeted therapy, and immunotherapy can affect the entire body. Then palliative treatment, which involves relieving health symptoms associated with the cancer such as trouble breathing and pain. Then surgery, which removes as much of the cancer as possible. Surgery is often used in combination with some other therapy in order to make sure all the cancer cells are gone. Then chemotherapy is a form of aggressive cancer treatment that uses medications that are toxic to cells to kill rapidly dividing cancer cells. It may be used to shrink the size of a tumor or the number of cells in your body and lower the likelihood of the cancer spreading. Radiation therapy, which uses powerful focused beams of radiation to kill cancer cells. Radiation therapy done inside of your body is called brachytherapy, while radiation therapy done outside of your body is called external beam radiation. Then stem cell, that is bone marrow transplant. This treatment repairs diseased bone marrow with healthy stem cells. Stem cells are undifferentiated cells that can have a variety of functions. These transplants allow doctors to use higher doses of chemotherapy to treat the cancer. A stem cell transplant is commonly used to treat leukemia. Then immunotherapy or biological therapy, it uses your body's own immune system to attack cancer cells. These therapies help your antibodies recognize the cancer so they can use your body's natural defenses to destroy cancer cells. Then hormone therapy, it removes or blocks hormones that fuel certain cancers to stop cancer cells from growing. This therapy is a common treatment for cancers that may use hormones to grow and spread, such as certain types of breast cancer and prostate cancer. Then alternative medicines includes acupuncture, yoga, massage, meditation, relaxation techniques. The factors can include types of cancer, stage of cancer at diagnosis, location of cancer, age, and general health. Then prevention of cancer, which reduces your risk of developing cancer, can include avoiding tobacco and second-hand smoke, limiting your intake of processed meats, eating a diet that focuses mainly on plant-based foods, lean proteins and healthy fats, avoiding alcohol, maintaining a moderate body weight, doing regular moderate physical activity for 150 to 300 minutes, staying protected from the sun by avoiding direct sun exposure and wearing a broad spectrum sunscreen, hat and sunglasses, then avoiding tanning beds, getting vaccinated against viral infections that can lead to cancer such as hepatitis B and HPV. Then types of cancer. The first one is breast cancer, which develops in breast cells. Typically, the cancer forms in either the lobulus or the ducts of the breast. Lobulus are the glands that produce milk, and ducts are the pathways that bring the milk from the glands to the nipple. Cancer can also occur in the fatty tissue or the fibrous connective tissue within your breast. Then symptoms of breast cancer. A breast lump or tissue thickening that feels different from surrounding tissue and is new. Then breast pain, red or discolored pitted skin on the breast, swelling in all or part of your breast, a nipple discharge other than breast milk, bloody discharge from your nipple, peeling, scaling or flaking of skin on your nipple or breast, a sudden unexplained change in the shape or size of your breast, then inverted nipple, changes to the appearance of the skin on your breast, and a lump or swelling under your arm. Then bladder cancer, it occurs in the tissues of the bladder, which is the organ in the body that holds urine. Symptoms includes blood in the urine, painful urination, frequent urination, urgent urination, urinary incontinence, pain in the abdominal area, pain in the lower back. Then bone cancer. Bone cancer occurs when a tumor or typical mass of tissue forms in a bone. These are called bone sarcomas. A tumor may be malignant, which means it's growing aggressively and spreading to the other parts of the body. A malignant tumor is often referred to as cancerous. Bone cancer can begin in any bone in your body, but it most commonly starts in the pelvic bone or the long bones in your legs or arms, such as your shin bone, femur, or upper arm. Then symptoms of bone cancer include pain and swelling in the affected bones, hard mass in the long bones of your limbs, pelvis or chest, feeling tired, pain in your bones that wakes you up at night, bone pain that can start after minor trauma, then decreased range of motion. Then lung cancer, the early symptoms of lung cancer include shortness of breath along with unexpected symptoms such as back pain. Back pain can occur when tumors cause pressure in your lungs or when they spread to your spinal cord or ribs. Then a lingering or worsening cough, coughing up phlegm or blood, chest pain that worsens when you breathe deeply, laugh or cough, hoarseness, wheezing, weakness and fatigue, loss of appetite and weight loss, recurrent respiratory infections such as pneumonia or bronchitis. Then skin cancer, it occurs when mutations develop in the DNA of your skin cells. These mutations cause skin cells to grow uncontrollably and form a mass of cancer cells. Exposure to UV light is a significant risk factor for many types of skin cancer. UV rays damage your skin cells. When the damage causes an overgrowth of cells, skin cancer develops. Then symptoms of skin cancers. It includes skin lesions, a new mole or unusual growth, bump, sore, scaly patch or dark spot develops and does not disappear. Then the two halves of the lesion or mole are not identical. Lesions have ragged and uneven edges. Then a spot has an unusual color such as white, pink, black, blue or red. It could also have more than one color within a lesion. The size is larger than 1/4 inch or about the size of the pencil eraser. You can detect that the mole changes in any way, such as the size, shape, color, or symptoms like itching, pain, or bleeding. Thank you. I hope you understand the significance of antineoplastic drugs in cancer therapy.